This is post-operatively one patient. She has been operated for radical excision of endometriosis along with bilateral parametrectomy for extensive endometriosis. So, what are the post-operative counseling or complications that we should advise the patient to look out for?
Right. See, parametrium is divided into two parts. One is the vascular parametrium and second is the neurogenic parametrium. So it is the neurogenic parametrium where all the nerves are located through the inferior hypogastric plexus. In fact, like how we have done for her and her family, before we do parametrectomy, we should counsel the patient that there is a 10% risk of having a post-operative urinary retention in all these patients. This urine retention is very unpredictable. Some people may have prolonged retention for 3 to 6 weeks. We have had 2 patients so far in our career who are still doing self-catheterization despite having been more than 1 year of surgery. But she is very lucky. Despite doing bilateral parametrectomy, though we want to do only one side, ideally, her disease was very severe. We have done it bilateral. She has passed urine within 24 hours of surgery. So that's a great thing. The only problem is we as doctors or science is not reached till a point where we can pinpoint and predict that this patient will have urine retention. This patient will not have urine retention. And when you have urine retention, it is little difficult for the patient in the initial phase to accept it, right? Because some of them may require prolonged catheter. Some of them may require medications to stimulate the bladder. 98% of patients with urine retention will become completely fine with that. But there will be that, one odd, like out of 5,000, 10,000, you have 2 people who are having prolonged urine retention. Both are wonderful young girls. So that is just something which, is a pin on our heart. Which is why we should counsel every patient pre-op, take their signatures, like how we did for her. She is a doctor, so we did it for her husband, and for her relatives that yes, please sign on this. Of course, these days people are very open about things, so they did sign on it. But God is very kind to the patient that she has passed urine. Now, because she has passed urine, despite such an extensive surgery, we can allow her to fly back to her home country. She is not from India, so she can fly out within the next 4 to 7 days and she'll be completely fine with no long-term complications. Okay?